Today, in the Capital Talks that we have curated on behalf of Truecopy Think, we have an entrepreneur who's also an innovator, Mr. Tony Jose. He's the co-founder of SugarStrings.ai, a Bangalore-based health tech startup building AI-powered genetic screening solutions designed to detect chronic diseases risks well before the symptoms even appear. But I would prefer to have this conversation not just to confine to SugarStrings.ai or only the technology, but let's also talk about the philosophy, the risks, the ethical side, and probably every other dimension of this topic. Before we start with something highly technical, let me ask a very personal question. How did you develop an interest in DNA? How do you found that DNA is a kind of a blueprint which has a lot of possibilities, not just in medical diagnostics, but also as a startup to establish a venture?
See, I would say that I came to this field by chance. So it happened during my master's degree, which I did in biotechnology from Loyola College, Chennai. And as part of the curriculum, I had to do an internship. And one of my professors recommended me to go to University of Delhi South Campus and do an internship with Professor B.K. Thelma, who is a very renowned geneticist in this country. And I had absolutely no clue what I was going to work on there. And then, like any other master's degree student, I went there to Delhi to do my internship. And that lab used to work on the identifying genetic markers behind a lot of chronic diseases, starting with Parkinson's, schizophrenia, diabetes, breast cancer, and so on and so forth. So that internship sort of gave me this thought process that, ultimately everything that happens in our body is controlled by our DNA. So that's the blueprint of our of life, and any changes in that blueprint can manifest into different traits or sometimes diseases. Now that sort of got into me, and then I decided to start my career in genetics and genomics, and that's where the whole journey started.
And I think most entrepreneurs would prefer to build something around convenience and scale. But in your case, you've chosen to do something around prevention. Why was that?
So that's a long journey. So after my internships at the South Campus, I went on to join a company that was into genomic research. So from there, I started my own first venture called Clevergene in 2013, where we were offering genomics as a service, wherein we would collaborate with institutions like All Indian Institute of Medical Sciences, IITs, and Oxford University, and several such universities, wherein we were helping them identify DNA-level biomarkers which are associated with diseases. And that journey went on to genomic-based diagnostics, wherein we were offering solutions and tests that would help in diagnosing genetic diseases after the symptoms have appeared. There, when we were working on the diagnostic field, there are a couple of incidences that sort of gave us this insight that, one, there are intricate technical challenges in doing genetic-based diagnosis, and second, the whole philosophy of diagnosing after a disease has manifested or advanced has got its own challenges. So I'll explain that with two examples. So one was the case of a 9-year-old boy who came to us for diagnosis, and his parents had taken him from doctor to doctors, hospitals to hospital in multiple cities in the country, and several conventional tests were done on that kid. Even genetic tests were done on him, but they were not able to identify the root cause of what is causing his discomfort. And finally, when he did a comprehensive genomic screening, we identified that he has a cholesterol metabolic disorder, and the treatment to that was cholic acid. And cholic acid is a very simple 20 rupees tablet, and by administering that drug, doctors could recover and treat him in a span of 3 months' time. Now, if they had not got their diagnosis, this disease would have gone into a neurodegenerative state, and the kid would have died by the age of 20. So this gave us this thought process, why even when they went to doctors, why were they not looking at the DNA level diagnosis? They were all looking at other diagnosis, and then finally when nothing worked out, that's when the DNA-based diagnosis was triggered. Probably because people thought that genetic diagnostics is expensive and therefore we'll use it as a last resort. That's one thing. Second thing is my own case. So as a child, I had an undiagnosed liver disease. And it took almost 5 years of going to doctors, treating for symptoms, etc., etc. And then finally, as I grew up, slowly the symptoms have started subsiding, and then I came into a normal life. Now, this has always nagged me. And when I started my profession in genetics and genomics, then I realized that this could be a genetic disorder. And a few years ago, I sequenced my own genome, but still we could not get the diagnosis. That's where the technical intricacy comes in, wherein most of the genetic markers that we have in the global databases are all built on the European ethnicities, because a lot of research happens in the US and Europe. And therefore, if you don't find the exact match of the DNA marker in the patient, in my case, I'm an Indian, you don't get a diagnosis. And that's where we started thinking about like how do we build a technology that can be population agnostic and which can be used for everybody else. And from the first story which I told about the kid, we thought, how can we push genetic diagnosis as the tier one or first level diagnosis? And that's where the whole thought process behind moving from diagnosis to preventive screening came into our mind.
So the idea actually came from your own experience.
Yes. So, I would say that it took me 42 years to diagnose myself.
So in our conversation initially before this interview, you had mentioned several terms. One thing which was sounding quite fascinating and something which was new for me was upstream medicine. If you could just elaborate for a layman to understand what exactly it is, that helps.
So when you look at human diseases, a vast majority of them are controlled by our inherent DNA mutations. Yeah. And when you talk about a genetic condition, we are all born with that DNA error that would lead to a disease sometime in the future. So these are hidden in our DNA, and it's just waiting for the right conditions to happen so that it would manifest. Right? It's like a landmine waiting for somebody to step on it. Right? So if that landmine is already there, then why can't we diagnose that person for that risk even before symptoms come? Right. And if that happens, there are chances that we can prevent those diseases. And with that diagnosis or the upstream diagnostic report in your hand, when the symptoms comes, you don't have to really go through that diagnostic odyssey to identify what's going on and then treat. So we are, you're prepared to treat that disease even before the symptoms appear.
Right. So from your experience so far, do you think the modern healthcare has knowingly or unknowingly or intentionally or unintentionally normalized waiting for the symptoms instead of proactively being, taking cues and understanding health at a much deeper level, how it is done using a DNA testing?
Sure. See, I think the healthcare has advanced significantly in the last 100 years. About 100 years ago, we were fighting infections. Right. And at that point in time, we did not have the technology to even see a microbe. Right? So once we had the technology to see microbes, we started fighting infections. And once the infections are controlled, then other kind of lifestyle disorders and late onset diseases started coming in as the challenges. So I would say that the technology and the healthcare system has been always evolving. And now we have reached a stage where with the advancements of genomic DNA sequencing and the artificial intelligence, machine learning advancements, it's now possible for us to look into the DNA before symptoms comes. And that's where we are now having these conversations around DNA-based diagnosis, prevention, screening, etc.
When people hear about DNA testing, I think this is the biggest question that probably we'll be discussing today, or probably we'll be anchoring our entire conversation on. Many of them imagine that it's something to do with ancestry reports. It's probably because of the lack of awareness. Could you just help us understand the process behind clinical grade genetic grading, and how is it done at the back end?
So for us, at least at a philosophical level, one has to first take care of deadly diseases that can either take life or reduce the quality of life, right? So when we talk about a clinical grade DNA screening test, it looks at only the predisposition to diseases and look at ways of diagnosing, detecting them as early as possible, and help a doctor and the healthcare system to either prevent or treat that better, right? So that's the differentiator that we have for a clinical grade DNA test. And when you do a clinical grade DNA test, it also has to adhere to certain norms and certifications and guidelines, because I can never give a report by saying that, hey, you have a 30% chance of getting something or a 60% chance of getting something. Instead, the report has to be definitive, avoiding unnecessary or avoiding over-diagnosis or unnecessary anxiety for the person who takes the test. So a clinical grade DNA test should ideally follow the guidelines of ACMG, which is the American College of Medical Genetics, which is the global body which sort of comes up with guardrails and guidelines as for how.
Similarly, are there Indian bodies as well which approves or recognizes such tests?
Right now, no. So everybody around the world follows the ACMG guidelines for for the reporting formats, and for a laboratory, we can get into the NABL certification, which is an Indian body, which is a laboratory process certification. Globally, we have CAP, which is the College of American Pathologists certification. They're all for the processes and for the laboratory as a whole. But for the test, it's usually we all adhere to the ACMG guidelines. And when it comes to genetic data and healthcare data, we also have to adhere to certain data privacy and protection protocols, such as the HIPAA from the US, etc. So yeah, these are certain things one should adhere to.
The more I try to understand, I got to know that this testing has the possibility of predicting almost 6,000 different variants of diseases, which is quite impressive. At the same time, it's terrifying, right? So how should an ordinary person emotionally, or maybe there are cases where you've gone, where you had to address, how should a person emotionally take this once they get such a report?
Right. Now, I would say that there is a preparation that is required even before the test is taken.
Is there a counseling that you do?
Right. So we provide something called as a pre-test counseling, right, wherein the scope of the test is explained, and the out-of-scope things are also explained, right? So that's one thing. And second, we have realized that there are three primary audiences for this test, or primary reasons why one should take the test. One is when there is a family history of diseases. For example, if I have a history of cancers or heart diseases or any other chronic disease in my family, I am also at risk of getting that disease. So therefore, I may have to take the test. Second, I myself may have a undiagnosed or unresolved health condition that has been nagging me for several years. So by getting a root cause diagnosis, I can get better treatment. Third, if I'm planning to expand my family or to have children, that's a time when I would look at a test like this. And a fourth case would be that anybody should ideally take, because many times what happens is that I could be the first one who would manifest that disease in my family. So by just thinking that there is nobody else in the family has a disease, I can't say that I can't be the first one to get that, right? So those are some of the reasons why one should take the test. And second thing is the way the test is designed. So although we have a scope of 6,000 diseases, like I mentioned earlier, we don't give you a scorecard by saying that there's a 20% chance for something, 30% chance for something else, 60% for something else, etc. Instead, in this test, we would find those one or two clinically actionable findings, which could be either for a risk of maybe a future cancer or a heart disease, or it could be a finding which we found, and then during the post-test consultations or clinical evaluation, we do find that that person may already have those symptoms which are matching the finding, and therefore treatment can be triggered. So although it's a 6,000 disease scope of the test, the report will only have those 1 or 2 clinically actionable findings. So we are not building a test which is to scare you, but instead give you insights that can be taken to a clinic.
Just as we mentioned at the beginning of our conversation, most of the healthcare system is designed to be reactionary. Your method is more about preventive medicine or preventive method, or let's say proactive way of diagnosis. So what would be an ideal age to do such a test or such a diagnosis?
The ideal age scientifically could be at birth, because we are born with all the DNA mutations.
You meant to say every newborn baby has to ideally?
Ideally, every newborn baby has to be screened at the DNA level at birth itself. So today we have newborn screening programs wherein they look at biochemical markers for maybe 50, 60 diseases. That has to be replaced with a comprehensive DNA screening test in the future. So if that happens, you basically are being born with, or at the birth itself, you have a report which say, hey, these are the diseases that you would be at risk of developing in future. And the reason why I'm saying that at birth is because when you talk about the spectrum of diseases that we cover, there are diseases that are congenital, which means the child will be born with those diseases or manifest their diseases at birth. There are diseases that would manifest during infancy, between 0 to 5 years of age time. There are diseases that would manifest during adolescence. There are diseases that would come up during early adulthood or late adulthood, etc., etc. So you would never know, like, what am I born with? So I cannot put an age group by saying that after 18 you have to take a test. Right? That could be counterintuitive. So at birth would be the ideal age to take this test.
That once taken, should one take it again?
So there is a technical nuance to it. So ideally for the scope that we are covering, you don't have to. But then the technical nuance would be that the science is evolving, right? The resolution is evolving, the knowledge basis would evolve, etc. And therefore, it is possible that a gene which is not associated with any disease today can be identified as a disease-causing gene in future. If at that case, you'll have to take a retest. But otherwise,
and in that case, what would be the ideal age gap within which this test has to be taken?
Yeah, so it is not a very established answer at this point in time, but I would say maybe 10, 15 years, because I don't think any significant thing would change during this time.
Yeah.
But ideally, like any genetic test, including our test, can be considered as a once in a lifetime test for the scope that we cover.
Another question which comes to my mind is, can DNA predict the diseases accurately, or is it about possibilities or tendencies or some assumptions?
It can predict with a great accuracy. And I would explain that using an example. So example, let's say you bought a new car and the car came with a king in the engine, right? Now that, there is a slight thing, you can drive your car without any problems. But let's assume that this can get into a problem if you push the car above, let's say, 100 kilometers per hour, right? So a genetic reason, like I said, it's like a landmine waiting for somebody to trigger it. So if those triggering factors are not there, many times it will just stay silent forever. But if the right conditions come around, it would manifest. So that disease-causing mutation is there, and that's a fact. Whether it would express or not is based on the other factors.
So if genes can already predict one's future, what is the need for a lifestyle change? I mean, people also do a lot of lifestyle changes. They change their food pattern, a lot of their lifestyle. Would that impact?
Yes, and yes, to an extent, because again, I have to say that it's a large, comprehensive field. So there are diseases that would manifest irrespective of your lifestyle, and there are a large number of them would wait for these environmental triggers, right? For example, diabetes, right? So diabetes, there are multiple types of diabetes. So we all know about type 2 diabetes, right? Which is lifestyle driven with the genetic component. Right. So wherein somebody who is prone to type 2 diabetes at a genetic component, based on his or her lifestyle, it would manifest. But there are also diseases, diabetes like type 1, which would anyway manifest at an early stage because there is a gene mutation. So there are those factors. But everything that we do in our body is all controlled by our genes. So the way I metabolize carbohydrate would be different than how you metabolize your carbohydrate based on your genetics. How you metabolize the lipids would be different to my genetics. So it's all been controlled by those nuances in the DNA.
I was also thinking about the other external factors like stress, the food that we intake, or the sleep pattern, the environment that we are living in. I mean, wouldn't that also impact our health?
Definitely. So there's a concept called homeostasis, which is balance, right? Now, certain things that we do can actually, create that imbalance and can aggravate these diseases if you don't take care. So yeah, definitely your stress, your food habits, sleep patterns, etc., would definitely have an impact on your health.
So can we philosophically say that genetics loads the gun and lifestyle triggers?
Absolutely,
right?
Absolutely,
Pulls the trigger.
Absolutely.
Another thing which I wanted to focus in our conversation was about the usage of AI. So where does AI come into the picture in the genetic screening?
There are two areas where I see AI coming in. So number one, initially I told you that all the genetic tests that are available in across the world so far, they're all built on the Caucasian ethnicity, right? So there what we've been doing is that there is a database of DNA mutations which were already been identified, and I sequence my DNA and compare with that database. And if I get a book match, then I say I'm diagnosed with this particular disease. Oh. But there are also instances where I may have a DNA mutation or a gene mutation which is not there in the database. Now, it is possible now to use computational models to qualify those mutations that are not already there in the database and give me that diagnosis irrespective of somebody else was diagnosed earlier with that mutation or not. So that's one part where AI machine learning would come in. And we do use that. That's our proprietary or USP that we have built in to make our tests population agnostic. And second, right now, how AI helps is that once you get the diagnosis, how do you interpret that? How do you correlate that with the clinical manifestations? How do you pull information from this whole vast amount of information that is available in the web, and then put that in the context and empower both the patient and the doctor with that information, and then guide them through the whole process of preventive precision medicine.
Yep. So I think traditional medicine has also gone ahead with robotics and several other. But I'm still, as a layman, I'm still very skeptical of my body being operated by a robot. So I think it's a common thing about the skepticism, this fear, or usage of AI and technology in medical diagnosis. How accurate, how reliable are the clinical tests, and how do you ensure that reliability of the DNA-based tests when you apply AI in your entire process?
So it all depends on how do you train that model, right? So the more you rigorously train the models with as much information, as much data as possible, it becomes more accurate. And what we say is that AI at least won't have person-to-person skill variations, right? So in that way, we basically are normalizing that machine to perform every time with the same accuracy. Yeah. And by training it better and better and working behind it to make it better, you're also improving this accuracy. And I think it has reached a stage wherein AI has become quite accurate. I'm saying it's sort of becoming near perfect accuracy for many of the things that we do using AI.
I think another term which you had used in our conversation is personalized medicines.
Right.
How advanced have we become, and how is it different from a traditional way of healthcare?
Sure. So when you talk about personalized medicine, there are two aspects to it again. Number one is how each person metabolizes a drug. So if I'm being given aspirin, the way I metabolize aspirin would be different than somebody else, right? Therefore, the dosages that are required for me would be different. Say, I might require higher dosage if I am a rapid metabolizer. I may require lower dosage if I'm a poor metabolizer, etc., depending on the metabolic pathways. Second thing is that I may even have adverse reaction to certain medications. Certain medications can, I will intake it, but then my body will not expel it as efficiently as possible and become toxic to my body. So you can find adverse reactions also.
Right.
Now, based on genetics, it's possible to now, one, do a dose adjustment and avoid medications that either be toxic to me or may not even work to me at all. I'll give you an example with a very commonly administered antiplatelet drug, which is an anti-blood clotting drug called clopidogrel.
Okay.
Very, very commonly administered for cardiac patients. A group of patients do not even respond to that drug, which means the doctor would think that he has given the drug to the patient. The patient would think that he is taking the medication, but that medication has absolutely no effect on him.
Why is that so?
Because his body is not metabolizing it the right way. Right? So in such cases, you basically are avoiding those trial and errors wherein you wait for several months or years to understand that this person is not metabolizing this drug properly. But if you have a genetic report before doing this, then you not only know that clopidogrel won't work for that person, but you can also identify alternative drugs that would be effective for that person.
This actually partly answers the question which I had in mind, which I want you to answer. Let's say there are two individuals having similar lifestyles, similar food habits, but they have two different genetic profiles. So would that have any kind of an influence or impact in their health report?
Yes, absolutely. Absolutely. So like you said, you all genetics loads it. So
I think we have already entered into this era of personalized gadgets. I mean, I think Nokia had personalized phones. And a lot of other products are now customized and personalized. Are we also entering into this personalized healthcare space, and how advanced is it globally and also more specifically in an Indian context?
Right. So it is catching up is what I would say. I mean, I wouldn't say that nowhere in the world it has reached a stage wherein, every medication has been given after taking a genetic test. It's still catching up. But certain countries are ahead of us. For example, in the US and certain European countries, they have started administering medications based on advanced diagnosis using DNA. For example, UK, if you take, they have an NHS program wherein based on their criteria, they would definitely do a DNA-based diagnosis before even they start the treatment. In cancer, there are NCCN guidelines which say that for vast majority of solid tumors, one should do a genetic test before medications are given. So it is already happening. And countries like India, we have seen great adoption in the last 10 years or so. About 10 years ago, I would say there were a handful of doctors who would even know about genetic tests. Today, any doctor, any hospital you walk into, they all at least know about this. And a lot of them are using genetic testing in their routine practice too. So it's happening.
Yeah. I'm now thinking more from a layman's point of view. Let's say Mr. X does this sort of an analysis and he gets a report and identifies a chronic illness. Now, natural that he would be under stress, he gets paranoid. Now, how do you, of course, you are also providing counseling. How should a person take the reports? Sure. What is the sort of an approach that you want a person to have after having to know that he's diagnosed with a disease?
Sure. Now, first of all, as per ACMG guidelines, every genetic report should be complemented with the post-test counseling. That's the guideline, right? Okay. And therefore, I can never give you a report and then just let you...
Which you also do.
Which we also do,
okay.
Right? And during that counseling session, what we basically do is first understanding that person's family history of diseases and his own health histories. And we see, can we correlate this to what we found, right? If we can already correlate, I think, then we are empowering that person, right? For example, if I found a cancer-causing mutation in my report, and I already know that there are relatives of mine who had cancers, and it is empowerment for me. So there's less anxiety. And then this counseling goes further to tell me, what should I do now? In certain cases, I may have to take an immediate clinical action. I'll have to go to an oncologist to do further follow-ups. That's number one. Second thing, I also now know what should I look out for, right? Because if you look at cancer, many times, you go to a hospital and get diagnosed for cancer when it is in stage 3 or 4, because that's when the discomfort starts. That's when we start, observing that something is wrong, not okay with me, right?
That's what we were talking about, reactive. The medical care is still reactive.
Correct. But then when you talk about cancers, the symptoms can be as vague as loss of appetite. Now, loss of appetite can happen because of many reasons, right? But if I know that if I have a genetic mutation that can lead to, let's say, colorectal cancer, that loss of appetite can be one of my early triggering reasons to go to a doctor, right? And there are, again, clinical guidelines which say that if I have certain mutations, I may have to do certain surveillance tests as early as possible. For example, if I have the same example, if I take, if that mutation is for, let's say, Lynch syndrome that can lead to colorectal cancer, I may have to start my colonoscopy-based surveillance at the age of 25 years old onwards and find those polyps in my colon before it becomes a cancer and remove them. So it is possible to now prevent diseases. Second is this whole surveillance thing. Now I become more aware about what should I look out for. Right. So if I have a house at the beach, I'm more worried about the waves than wild animals, right? So I can get my surveillances optimized based on that. So that's another thing that can happen. In cases where I find something wherein there is absolutely no family history, no health history, etc., then again, that's an information that I should keep with me for the time being. And again, it's just about surveillance. And if I have the symptoms coming in, I exactly know this is a report I should give to my doctor and then take the action further. So the purpose of that post-test counseling is basically to prep you not to get anxious about it and don't overthink and do the Google-based and the AI-based researches to take your own assumptions and then freak out.
Another concern which I had is about the data privacy. Who actually owns this genetic report? Is it with you, your organization, or does it the entire ownership gets transferred once the report is generated to the one who had done this?
Yeah, the ownership of the report automatically get transferred to the customer who takes the report, like any other diagnostic test that you take, right? Now here there is another concern which people have, that I have your genetic data,
right?
That what will I do with that data? That's another question which usually comes up. So ideally, or I would say that the customer or the individual owns his genetic information. And I, as a company, should not use that data for anything else without his explicit permissions.
Okay.
Right? So it belongs to that person, right? Now, there are again guidelines which prevent me from freely transferring the data to anybody. Right? There is HIPAA guidelines from the US. Right. There is DPDP guidelines that are coming up from in India, etc. So, it's you who owns the data. And as a company, we have a policy that we never sell your data.
Right.
Because you have paid me for the test, I have given you the report, and our relationship ends there.
Yeah.
And I will not use your data for anything else.
But I think there are also a lot of concerns or misunderstandings about how insurance companies or third parties would use the data, your private data, which is there in their hands.
Right.
Are there any laws or are there any such instances which you've come across?
So there is a court ruling from Australia which has prevented insurance companies to discriminate people based on their genetic predispositions. So that's now there is a court rule on that.
Is that applicable in Indian context as well?
That's one of the examples that we have from across the world, right? Second, how will an insurance company get your genetic information unless somebody gives it to them? It has to be either you or the company, right? And the company is not allowed to transfer any information to a third party without the explicit permission of the owner of the data.
Right.
So if I do that, that's basically a breach of a law.
So as a continuation of the earlier question, what sort of an ethical safeguard should exist in the genetic technologies and even in organizations or startups like yours to make it more mainstream, to make it more popular and more acceptance, to gain more acceptance to this sort of?
Again, our observations and our own understanding learnings in the last 15, 16 years when we've been in this field is that if this has to become mainstream, we have to give the power in the hands of people, right? We should empower people to be more proactive about their healthcare. They have to be more participatory in their healthcare. And they can be participatory in their healthcare when they're healthy, not after they fall sick.
Right.
Because once you've fallen sick, you have absolutely no control on what will happen to you. Because you're already sick, you've gone to a doctor, the doctor would will treat you. Right. And even my choices of going to the doctor will be based on my conveniences. For example, if I have a heart attack, I'll be taken to the nearest hospital and to the nearest doctor. Maybe not to my choice of hospitals and to my choice of doctors, etc. Okay. But if I have my understandings about what is that I am prone to, who could be the best doctor who can treat me, and if I'm already in a relationship with, already in contact with the doctor, my whole treatment will become much better. So we believe that it has to come, the whole power has to be given to the consumers and people, and not wait for an institution to come in and then make it a norm. And that's the reason why SugarStrings has gone direct to consumer. Right. So this is where we are trying to make a difference.
Coming back to the business part of the venture that you are in, I think all of us would agree that we in India, a lion's share of the people still doesn't have access to, or even affordability is a big concern.
Correct.
Now, given that, my assumption is the cost for one test is close to 60,000.
Correct.
So, how easy is it for you to sell this idea when there is a lot of suspicion, when there is a lack of awareness, especially in a context like India, where a majority of the people cannot even think about basic healthcare?
Right. In fact, we were pleasantly surprised. So we also had a lot of thoughts around how to price it, how low can we go, etc. But then there are certain costs involved in delivering a test like this, and therefore we had to price it at 60. And what we realized is that it's not just the affordability which is driving it; it's also the value associated and the need.
Right.
Right. So somebody who has seen pain in their family would associate value, and therefore the price will not be the judging factor for them, right? And so that's one thing. So we've seen that, and if you look at the affordability and the acceptance of accessibility and the acceptance of things, I believe that's also to do with priorities and mindsets, right? I mean, a lot of people would think that, okay, I don't want to give a 5,000 rupees insurance premium. Yeah. But at the same time, you do see that person going and spending much more money on something else which he likes, right? So it's people's choices and priorities too. So I think that's something which we cannot change at this point in time. But then I would believe that there is a large number of people in India who have taken their health very seriously, and they are willing to invest in their health and healthcare before they fall sick, and then they lose their lives and quality of
again,
life.
A continuation of what you said. Many people are okay spending heavily on their electronic gadgets. They might spend for a new iPhone, but at the same time, they wouldn't be. Is that because of the lack of awareness? In such a space, what is the intervention that you're doing to spread awareness, or probably to market your entire business idea?
Yeah, so we do. I mean, other than the conventional marketings and promotions that we do, this podcast is one of those. The reason why, I readily accepted your invitation was this:
to spread awareness.
But to spread awareness, because it's not about selling my test always. It's also about selling that concept and making people aware that this is possible. And I'll give you an example. We recently tied up with Astra MedCity in Kochi, wherein our test is available through their wellness center. A lot of people who walk in are like, oh, we never knew that something of this sort is possible. Right? So it is important for us to get that awareness spread, and then and then mature the people to get into this testing and further action.
And in that process, what challenges do you face in spreading that awareness? Is there an acceptance among the doctors community, or is there a trust issue over there as well?
I believe the doctors are accepting it much more aggressively, because even for a doctor, when a patient sits in front of him, his primary job is to diagnose that patient. Right? The whole thing goes around, what is this person suffering with? What is the root cause of it? And if I get that, that treatment becomes effective. So for doctors, this is a tool that would help them to get the root causes and treat a patient better. And there are also doctors who are, in fact, especially in the cardiology and oncology space, there are doctors who are now started recommending this test to family members of their patients, right? So that they can prevent these diseases in those members.
And I also feel you are actually in an emotionally very sensitive space. So as an entrepreneur, how do you innovate and at the same time strike a balance with responsibility? How do you strike that balance?
I think that's a tough one. So right now, what we are focused on is on the innovation part, wherein we are building these tools and possibilities that we can give to people. The emotions, I believe, are secondary for us, and I believe that if I am able to, really help a person to, let's say, avoid an avoidable death, that's a win for us. If we can help somebody to resolve their years of diagnostic odyssey and get a treatment, that's a win for us. And those are the places where we do see emotions, and we do see them getting connected to us at a personal level. Because there are a lot of our customers, early customers, who has become friends with me. Right? So it all happened because we have touched their lives. I think emotions comes as a secondary outcome for us, and our primary focus is to make sure that how can our test be more accurate, more comprehensive, more useful, etc., etc. And how can we build that ecosystem of clinical experts who will support this test? So that's where we are focused primarily.
Right. And I also remember about a year or two back, you had taken part in the Shark Tank. How has that helped strategically for the company in positioning or probably spreading awareness about DNA testing?
Yeah. So when we went to Shark Tank, we were very early, and the reason why we went to Shark Tank is to spread that awareness, because any amount of money that you have, you cannot bring in that kind of awareness which Shark Tank brings. So that's one thing. Second is credibility, because it's a very rigorous process. I mean, it goes through about 7 to 8 different rounds of selections, and there were about I think there were 3 lakhs applicants, and only 100 of us got the chance to pitch. So it has gone through that level of rigorous scrutiny, and they are very, very, very thorough in their due diligence. So they have business teams that ask you business questions. There are technical teams which ask you technical questions. So, and they want proof and validations for every single thing that you speak over there. So, we've gone through that credibility building thing. And third of all, it was also a pressure test for us. We want to say, what are the kind of questions that would come? What are the kind of reactions that we would get when you go and pitch something like this, right? And one of the things that we got is that your guys are too ambitious. This sounds too good to be true, right? So after the event, then our whole effort was how do we justify, or how do we build things behind this too good to be true, this comment, and show people it's not too good to be true, it is possible. So that Shark Tank event really, gave us that pressure test to work behind some of these things.
Yeah. Now that we are talking about strategy, who are the other competitors in this sector? Are you the only players in India?
Yeah, so we again look at a global level. So for us, my global competitors are, and then I'll come to India. So my global competitors are, there is a company called Nucleus Genomics from California. They do part recreational, part clinical grade stuff. But then they also have the disadvantage of being a Caucasian biased test, and they cover about 2,000 different diseases. There's another company called Circle DNA from Hong Kong. Covers about 500 different diseases, and again, it's based on markers. So if there is a prior history, if that marker is there on the database, then they can diagnose. There are other companies like Invitae, etc. They're in the diagnostic space. So there are a bunch of them globally, and in India too, there are a few companies that are again in the recreational slash selective testing for cancers, selective testing for heart diseases, etc. But then we have a different philosophy wherein we want to cover everything in one test, because we realize that the patient or the customer do not know how to select panels and tests. So we don't want to give you that pressure of, okay, I only want to check for cancer, then spend 25,000 rupees. Then later you realize that, okay, I should also do for cancer, heart disease test, another 35,000 rupees, then something else. So we don't want you to go through those things. So we made a very comprehensive thing.
Suppose I wish to take a test. What should I do? Just tell us the different stages until I get the report.
Sure. Come to our website, which is www.SugarStrings.ai. Order the test from the website. Give your address where we should send you a sample collection kit, and we have made that sample collection
So it
easy.
comes home.
Yeah, it comes to your home, and you have a swab which you have to just take, and like a COVID test, everybody is now aware of that swab collection. So you don't have to go like deep into your throat. Instead, just inside your cheek, scrape some of the buccal cells and put into a persevering solution that we provide. And once the sample is collected, just let us know. We will collect the sample back from your home across India and take it to our laboratory in Bangalore. That's where the testing happens. And once the report is ready, either we provide you an online consultation, by a certified genetic counselor, or in cases like Astra, wherein we have a physical center, you can go there and then do the offline consultation.
So you also have a couple of people who are certified genetic counselors, doctors. You have a network with hospitals, all that you provide.
Yeah, so we have our in-house genetic counselors, and we are building this network of hospitals who would work as our clinical partners. Our first two partners are Narayana Health in Bangalore and Astra Medcity in Kochi. And we are expanding that network. And not only in India, we're also doing pilots in South Africa, UAE, and Kuwait at this point in time.
So we've already gone global.
Correct.
Okay. Now that you would have had interactions with people of different age groups. Do you think the youngsters are more aware and updated? What has been your experience? Are they aware of this DNA-based testing?
So people with health troubles, they search. They are actively searching, proactively searching, and they discover us. And if we look at the age group, we see a sweet spot between 40 to 55 is where they are health conscious. And they are the ones who are proactively searching for things like this. So yeah, that's the age group that we see as the most proactive people.
Being a person who has been interacting with several hospitals, healthcare professionals, how do you imagine the healthcare sector evolving? Of course, the life itself is uncertain, but how do you see it evolving in the next at least 5 years from now?
Yeah.
Would the youngsters say that the reactive sort of treatment is completely outdated?
Yeah, I think the newer generations are becoming more health aware. Especially the Gen Zs, what I read is that they consume less alcohol, they are into healthy lifestyles, and they're becoming more proactive. So there is a generation that is becoming health aware as you go. That's a change from the consumer behavior side. And for hospitals, I think they're all looking at how do they get into the next, how do they redefine their businesses as they grow, because they can't keep on waiting for people to fall sick and then treat them. And you do see that hospitals are now getting into more wellness and preventive spaces too.
Right.
Every hospital that you talk about now, they have preventive screening centers.
Right.
They are setting up standalone centers only for this. So we do see even hospitals are now coming to the stage where they've identified that preventive screening is important, preventive healthcare is important, and they can't always wait for chronic diseases and then those end moments, uh, treatments. Yeah. So I mean, as a whole, we do see changes happening from people's mindset and as well from the healthcare ecosystem as well.
Right. Another thing it's just my thought, you could correct me if I'm wrong. I don't think the number of hospitals present in a location is an indication of the health. It actually shows how that society is sick. Do you think the increasing number of hospitals can be compared or is equivalent with quality life, or how do you look at it?
That's an interesting question, and I've never thought about that. So one thing, you rightly said that the number of hospitals means that there are more sick people, or I can also put it that there are more sick people who are willing to take an action about their health. I don't think, I don't think there is more sick people in a particular region. I don't think that's a concentrated thing. I think it's more sick people who are willing to take an action about their health is what healthcare is my assumption is.
Okay.
Right. Yeah. So I think which is a positive thing that there are more people who are getting aware of their health care and then taking proactive action. And hospitals are now seeing that as an opportunity to establish those catchment areas is what I think.
All right. No, but what excites you the most, scientifically right now in genomics, and what worries you the most?
The excitement is the whole advancements in AI that has happened in the last 2 years and maybe in the last 1 year with agentic AI. There are things that we used to take months and years. We can do it in minutes these days, right? And then with accuracy. But then again, we have seen that, your AI is a very good slave at the hands of a bad master. So you also should be a good master to make sure that your AI doesn't give you wrong things. So it's very important to have people with that fundamentals correct to work with them. But then the kind of speed at which we can move things it's phenomenal at this point in time with AI. And with the generative AI and interactive AI, we can also see how the whole customer experience can be elevated, right? Post-test, if I have to make my customer to interact with the report or to us, it's a very different thing altogether. That's excitement. My worries are around, again, on data privacy is one of the things, because when you give things to AI, we also don't know where all it will go. So that's one worry I have. Second worry I have is, again, on conditions wherein we have a diagnosis, but there is absolutely no post-test action possible. And then, if that is swelling as an anxiety thing, that's another thing which worries me. Yeah, so these would be my answers to that.
Right. If we could also summarize some of the extremely common misunderstandings about genomics, if you could just list out.
So I would say about genetic diseases. So one, there is a misconception that a genetic disease means the child will be born with a genetic disease, right? I mean, people don't really correlate late onset adulthood diseases as genetic conditions. But if you look at many of these heart conditions, for that matter, and we cover 330 cardiovascular diseases which have got a genetic underpinning in our test. So people think that these things maybe are truly lifestyle driven because of fat consumption, sedentary lifestyle, etc. So that's one of the factors. But there are also a lot of unrecognized or not so very popular knowledge wherein there are genetic conditions that can lead to your heart to stop suddenly, right? Sudden cardiac arrest. And then, but by knowing this early on, there are treatments available to stop that. There are medications available. There are implantable pacemakers that you can put for preventing that, etc. So that's around the disease side of things. Another misconception around the genomics as a science is that genomics is for recreation. Like you can know my ancestry, or for nutrition, fitness, that kind of things is where things are a little popular over there. And there's also a lot of anxiety around this data privacy.
Right.
Right? And I want to make it a little light by saying here that it's a very, very complex field. We struggle to get that mutation, to find that mutation that can cause a disease. Just imagine if I have to, learn other things about you. It's a very, very complex thing. There is very, very little I can do with that data. Second, the data itself is huge. Storing the data is very expensive for us. So we don't want to keep on accumulating this data. And third, even if I share the data with somebody without any other information about you, I don't think what all can be done with that data. I mean, there is very little that can be done with that data with all the other identifiers removed. So I believe that one need not be very anxious about this whole data privacy part, especially when it comes to genomics, because we are living in a digitally connected world wherein you go to an airport, you don't even have to show your boarding pass. Your face has become your boarding pass, which means people can identify you just by your face, forget your DNA, right? I mean, and you use a phone and it knows everything that you're doing, right? They are much more dangerous than this, and they are also as dangerous as this. So I would like to, and we do keep getting this question now and again, that what will happen to my data? Will you sell it? So our answer is that we don't sell the data, right? And then you also don't have to get overly paranoid about that privacy part at this point in time, as compared to the benefit that you're getting for your health. Right? It's good. There's a huge upside of doing the test as compared to the downside of the data privacy, which anyway we are protecting by our own policies, and there are guidelines around protecting that.
If someone watching this interview has never ever thought about a preventive healthcare, what would your advice be to them? Like, how should they be approaching this?
See, every single person who watches this podcast must take a genetic test as early as possible, because none of us have got any idea what are we carrying, right? There could be those ticking time bombs that can be found as early and diffused. And I'm just telling you statistics from the number of people who have taken the test. 22% of the customers were detected with cancer-related genetic mutations, about 26% with heart diseases-related mutations, about 47% with other kind of diseases, and a staggering 72% were carriers of diseases, which means they may not manifest the disease, but they can potentially pass it on to their children. So this is much more prevalent than that we think.
Right.
And by knowing this as early, now there are ways of preventing these diseases. There are ways of treating them better and protecting life using this.
How should one look at this method? Is it about extending the lifetime, or is it about lifespan, or is it about improving the quality, or is it both?
It is both. So you can extend your lifespan by preventing avoidable deaths or early deaths, and you can improve the quality of life by either not get the disease to affect you or by treating them better.
Thank you for first of all for spreading so much of an awareness and addressing a lot of questions and concerns which ordinary people would have. On behalf of the Truecopy Think and the Capital Thoughts team, I would thank you for sharing your time with us. Thank you.